Hello, everyone, and thank you for being here today. My name is Nitin Molly, and I'm thrilled to walk you through a topic that is not only critical to public health, but also deeply personal and timely: the powerful connection between heart health and mental health. So, I believe we live in an era where mental health challenges are no longer whispers in the shadows. They are front and center, especially since they've risen in astronomical numbers since the start of the 2020 COVID 19 pandemic. And this is sort of caused by the isolation and other various impacts of the pandemic. And what often goes unnoticed is how profoundly this mental state affects our physical heart health, literally. And it's very well known how it affects our mental performance, our performance in school, work, along with our physical bodies, how they end up responding to poor mental health. However, there's not much on the heart itself. So this presentation will cover the unhidden connection, the hidden connection, sorry, offer research-backed insights, and leave you with practical strategies we can all begin using today. And also, mental health is a big value we generally try to convey at Blue Zone, as we believe mental health is a big epidemic within Americans and the rest of the world as a whole. So that's one thing we do try and convey a lot in our message. So here's sort of my general table of contents here. So what I want to talk about here is mental health summary about mental health and its impacts and what's sort of been happening in mental health so far. And the same will be done with heart disease, about heart disease, what I've learned about heart disease, and then next off go into the impacts of mental health on heart disease, so the sort of causative side of things. And then next off I want to also talk like at the end here about prevention of mental health problems that cause heart disease and prevention as a whole, since preventative health is extremely important, especially in today's age. So let's start off with mental health. Mental health refers to our physical, emotional, and psychological and social well being, and it affects how we think, feel, and act, along with determining how we handle stress, relate to others, and make choices. So, some examples of mental health include levels of anxiety and stress, emotional fulfillment, our ability to cope with life's ups and downs, motivation and energy levels, sense of purpose and self worth. So, sadly, over the last decade, and especially since the last 5 years since the COVID 19 pandemic, we've seen a steep rise in mental health challenges across all age groups, primarily younger people who are under 30. So, lockdowns, social isolation, economic stress, and general uncertainty have left a lasting mark. But the good news is mental health is not fixed. With awareness and effort, it can be managed and improved. Lastly, mental health impacts everything in our lives: how we eat, sleep, how motivated we are to do exercise, and how we perform at work or school, and how we build relationships. And it's also critical when it comes to heart disease as well, since it affects our eating habits and sleep, along with certain hormones that end up getting produced that we will discuss on later. So let's pivot on to heart disease. So, heart disease is the leading cause of death in America, unfortunately, and it's roughly causing around 700,000 deaths per year in America alone. And that's roughly one in every five deaths. It includes a range of conditions and types of heart disease, such as coronary artery disease, heart attacks, heart failure, arrhythmias, and more. So, heart disease gets shaped by genetic predisposition. However, a cardiologist I interviewed said this was typically not the main cause of heart disease that he's seen in his patients, especially when it comes to coronary artery disease, the most common cause of death from heart disease in the entire United States. But mainly the issue is lifestyle choices such as physical activity, drinking, smoking, etc., and diet, and mental and emotional health, which is a lesser known but significant influence. So, basically, just to go back to the point, the cardiologist I interviewed a while back said that lifestyle is often the dominant factor, especially when it comes to coronary artery disease and heart attacks, since typically we can improve our own lifestyle factors. And also, a lot of these lifestyle factors, key point here, are shaped by mental health in general. So that's sort of what we're aiming to help as well here, because mental health is not talked about enough, we feel. So it's important to talk about mental health and what it does for heart health. But without further ado, let's go into their connection. So, how does exactly like mental health impact heart disease? So let's break this down into specific pathways. First off is stress and blood pressure. Chronic stress elevates cortisol and adrenaline levels, which increase blood pressure and heart rate. Over time, this damages and narrows down blood vessels and leads to hypertension, a leading risk factor and cause of heart attacks and strokes. And then next is anxiety and cardiovascular reactivity. People with anxiety disorders often experience spikes in blood pressure and heart rate, sometimes even at rest. These fluctuations place chronic strain on the cardiovascular system, thus causing heart disease. Next off is depression and lifestyle habits. Depression can drain motivation, leading to poor diet, lack of exercise, and irregular sleep, all of which are harmful to heart health. And depression sort of causes people to sort of engage in less healthier habits, along with reducing serotonin and dopamine levels, which have been linked to increased inflammation and higher risk of heart disease as well. And typically, when there's less dopamine and serotonin levels being produced, there is sort of a high risk of these non dopamine, non serotonin types of chemicals that end up getting produced. So, as a result, that ends up causing high risk of heart disease. And next off is loneliness and emotional disconnect. So, a big thing here is that during the COVID pandemic, loneliness was a rising epidemic, and it's actually gotten worse, a lot worse over the last 10 years or so. And social and studies have shown that people who feel socially isolated or lack emotional support are more likely to develop heart problems. So, oxytocin, the connection hormone, is lower in those experiencing chronic loneliness. And oxytocin actually has a protective effect on the heart. So, it's actually heart healthy. And in short, your mind and your heart are not separate, they are a constant dialogue and mental stressors, the physical, real impacts on your heart. So let's back this up with a few research findings. So a study published by the by the Journal of the American Heart Association found that people with high stress levels are 27% more likely to develop coronary heart disease, the most common heart disease in the United States of America. And the American Psychological Association reports that chronic stress doubles the risk of a heart attack due to the sheer damage it has on your heart and what it does to the thinning and the narrowing of blood vessels in the heart. And next is the 2021 systematic review concluded that depression increases the risk of developing heart disease by 64%. So these numbers are not small, and this is sort of a call to action how we can go on and better improve preventative health for heart health and mental health. So now I want to sort of talk about prevention. So I want to sort of bring in our Blue Zone project strategies. So for those who don't know, the Blue Zone project is sort of a project that's built to help improve like life expectancy in years and try and teach how to eliminate and try and get people to eliminate certain factors that can cause shortened lifespans, such as physical inactivity and overconsumption of meat products, and typically overconsuming red meat products that are actually linked to coronary artery disease. However, that's besides the point. So, sort of in Blue Zone, we try to also talk about health habits and preventing stuff like coronary artery disease, depression, etc. So, our Blue Zone values here for mental health in general, because we're here trying to talk about mental health, is the use of exercise, community, purpose, fulfillment over pleasure, and self care. So, exercise is actually proven to improve one's mental health along with community, since community at Blue Zone is viewed as sort of like the one big way that people actually end up having a lot more satisfied and happy lives. And same with purpose, since purpose sort of causes people to have that satisfaction in their life that causes happiness. And same with fulfillment over pleasure. It's sort of that increase like happiness that's caused. And then self care as well, which is a sort of like all of these things combined with a lot more to it. So those are our main habits at Blue Zone that we use to improve mental health. So, in conclusion, heart health is a growing issue in America, as with mental health, as both for decades have worsened, especially in recent years. Heart health is deeply impacted by mental health, directly and indirectly, And what we can do is acknowledge the issues here and go on and try to use several practices to help us improve our own mental health and then consequently our own heart health, and also help spread the message to others. So share this video as well, since we're also looking to make as much impact with people as possible. So our habits here are exercise, community and social connection, purpose, and looking for purpose in general and trying to have that fulfillment in life, along with mindfulness and self-care and sleep hygiene as well. And those are sort of our main ways that we try and care for our own mental health and heart health at Blue Zone. Thank you, and follow and subscribe for more. And since we are looking to help people with heart health and mental health and other issues, and we also promote the Blue Zone Project. So we also recommend you search that up as well, since it talks a lot about heart health, not really heart health as much, but general health, along with a lot of stuff that can help with preventing heart disease, such as diet and exercise, etc. And thank you.